The need here is basically to have real-time information. And I think at this time, when so much information now is electronically stored, there is now a growing expectation, not on the part of providers, but also on the part of patients, that you should have access to the information that might be related to instances or visits that they had had in the past. And I think the attempt of Health InfoNet is to allow us to integrate all that together. Within a week of coming online was an individual who was involved in a serious motor vehicle accident in western Maine. He was brought to Central Maine Medical Center, where I don't have privileges. Because a HIE was there, I was able to identify when he came in, what his exam was and what it showed, what the laboratory findings were, what the CAT scan showed, what the MRI showed. It even showed me the admission history and physical on the part of the physician who was taking care of him. It also showed me the operations he underwent. Therefore, I was able to more easily coordinate my care with that individual, even though that physician was in Lewiston and Auburn, Maine, and somebody who I normally don't work with because I'm down here in Boardman. I had a personal experience and benefited from him because I was down east at one point, way down in Washington County on the sea, felling trees, and I have a tendency sometimes to go into an irregular heart rhythm. And the experience has shown that certain medications that you often use to correct it don't work, and I really need to actually be cardioverted, which involves actually placing the paddles on my chest and converting me. So I actually went over to Bangor, to Eastern Maine Medical Center, which is distant from my home, and went into the ER there and told them what was wrong, and I said, I'm in this rhythm and I need to be cardioverted. Well, that's kind of an unusual thing for a patient to say to them, and they kind of opened their eyes, and I said, oh, really? Well, what have they done before? And I wasn't quite sure. And I said, well, you know, 5 months ago I was cardioverted in a similar situation down in Portland, and I know they're part of HIE. They went into the record, saw it, and there it was 5 months before. The exact record, exactly telling them basically what they had done and what had been very successful. They went ahead and administered the same doses, both of the medication to put me to sleep briefly and also the strength of the electrical impulse that needed to be done. And I woke up 5 minutes later, I was back in a regular rhythm and waited around an hour and I was gone. So it was kind of an interesting thing, that something that I would normally as a physician be using on the benefit of other patients, I was now a patient and therefore directly benefited from this in a way that I wouldn't have otherwise.